All right, we're back with you guys once again. We want to help walk you through some of the coronavirus numbers, make it a little bit easier to find all this info. Garrett and I seem to stare at this info all day, and so it's probably easier for us to help you find these things and us to teach you where to find these things so that you can make the best decision for your family. There's a lot of numbers to dive through all the time, and the numbers that we're talking about today, the numbers we talked about yesterday and will be going forward, are Arizona-based numbers, unless we specifically say something is a national number. So really, we're diving into the Arizona numbers the most. Garrett, how are you today?
I'm lovely, thank you very much.
Good. We're thinking of everybody who has friends and family who are sick with this right now, or hospitalized, or those people who have lost someone as well. And we just want to take a moment and pause and think of those people, and then also keep the rest of you updated on all of the info that's coming out. There's so many headlines to talk about today, but Garrett, what I want to get to first, and for people that don't know you, you're ABC 15 data guru, and I want to talk about the numbers today and how things look. They usually come out between 8:30 and 9 in the morning. What did you see this morning popping onto the website?
Well, today Arizona has about 63,000 cases. Our number of deaths is just under 1,500. 1,490 deaths were reported. Not in one day. That's the total cumulative. Today, we reported just over 3,000 cases and 27 deaths. That number, that 3,000, that's become sort of an average at this point. And in fact, it's somewhat low from what we had last week. We were breaking records right and left last week, and so 3,000 on a Wednesday. It's Wednesday. No, it's Thursday. Oh my gosh. 3,000 on Thursday is actually a fairly low number for what we've seen. We did have a record number of diagnostic tests reported today, so our percent positive was considerably lower than what we've seen in the last couple of days.
You froze for a second there, Garrett.
Yeah,
I don't know if you did as well. Say that once again.
So I don't know where I left off, but we had about 15,000 diagnostic tests reported today. That's a record number of tests. Our percent positive as a state did go up again to about 10.9% of the total of diagnostic tests. And just to go over some of the numbers, just in case I froze, 3,000 cases reported today and 27 deaths. Are you there? Sorry, you're freezing again, Katie. My apologies.
Yeah, my shot was just buffering too, so I don't know if folks heard that. We'll have to find out. Let's see. We can chat with some of the producers on this cast too. But say that once again. I'm so sorry.
Sure. I apologize for everyone. 15,000 diagnostic tests today. That was a record. About 3,000 cases, positive tests were reported today, and 27 deaths were reported today.
What you were talking briefly, 15,000 diagnostic tests. That is a record for us so far in Arizona.
Yes, that is the highest number of tests that we have recorded so far.
Any special concerns about that or interest in that? Obviously, if we saw a change in the rate, that would be more of demonstrating something changing here.
Yeah, so again, we're seeing a much higher volume of tests being processed by AZDHS and the county health departments. But as you just said, we're still seeing a very high percent positive rate, especially in the urban counties right now. So that is a concern. What we're seeing in the case numbers today so far is there is a to put out just a possibility of some good news. We might be hitting a plateau on the number of cases that we're seeing. You know, with 3,000 reported today, only about 1,800 reported yesterday. We haven't broken any records on case numbers this week so far. That's actually a good sign. Obviously, we don't want to break these records. So, you know, that doesn't mean that things are going down. It just means that we might be sitting at a plateau for a couple of weeks.
Yeah, it doesn't mean that we should know the difference between a peak and a plateau.
Yes, yeah, we don't. I mean, the problem with doing all of the analysis on these numbers is we really don't get to see what's going on for about 2 weeks. It takes about 2 weeks for trends to truly materialize.
Yeah, I think people get so used to the learn right now, get the update right now, understand it right now, that to deal with things in a disease world and it takes 2 weeks, it's you want to jump to conclusions, but really you have to wait and see how things sort of pan out through all this.
Correct. Yes.
I know that you spent some time today helping one of our reporters working on a story, and that'll be coming up, I think, this evening. We'll find out for sure when Lily's story is going to run. But taking a little closer look at the communities most affected currently in Arizona by this virus.
Yes. So today we're going to be featuring a story this evening, as you said, from Lily, regarding how the epidemic has affected the Hispanic community. And I'm going to share my screen here really quick. And show you, and my apologies, I have a couple of these graphs up, so let me just make sure no, that's not the right one, sorry. Just make sure I share the right one. That one. Yes, okay, so what this graph is showing is how the Hispanic community in Arizona is getting hit very hard by COVID-19. The blue bar indicates the percentage of that demographic. White non-Hispanic is about 29% of cases. The Hispanic or Latino demographic is about 45% of documented cases. And then, as you can see, Native Americans were also hit very hard. And then the remaining demographies are around, the demographic categories are around what they were. But as you can see, there's this giant gap between both Hispanic or Latino and Native Americans, in which they have a disproportionately high number of cases. And in fact, when we looked at the zip codes, the top 10 zip codes of COVID cases in Arizona, the percent Hispanic in those zip codes is about 75% of the zip code. Of the average of those 10 zip codes is about 75% Hispanic. So the growth that's happening in Arizona, the high volume of cases are happening in Hispanic communities.
And one of the things that dives into is really becomes an equality issue, where they're looking at the access to quality care that's happening. That there's a closer look at the number of jobs that offer paid sick time, that people could stay home if they're sick.
Yeah, there's definitely some of those social variables to take into consideration as to why the growth is higher and sustained in that community. You know, some of the other variables that are also to be considered is a lot of Hispanic people have sort of the quote unquote essential jobs where they weren't able to stay home, and they can't stay home at the same numbers that other demographic categories can. So that could have impacted as well the growth in cases.
Yeah, and making sure that everyone's treated equally, and also hoping that there's not a fear of going and getting tested as well, that
Right.
people can feel comfortable doing that, and that there aren't long lines like we saw in some areas of town over the weekend. A lot of questions keep coming in. We're going to keep trying to answer some of those as well. What were some other key takeaways from today that you noticed in there, Garrett? It wasn't. We didn't have any overnight records or things like that, aside from the PCR, the diagnostic tests.
No, we didn't have any overnight records. Some of the things that I noticed today, one of the interesting aspects is that the case growth for the past several weeks, 3 or 4 weeks now, since May 26th, has been, for I guess a month, has been driven by the 20 to 44 demographic. Really, the 45 and under demographic has been driving the case growth, and we're starting to see sort of a leveling off of the increase in that demographic compared to the older demographics. So what we don't know yet is what I have to do after a trend line establishes is that mean that we're seeing more case growth in the older demographic or less case growth in the younger demographic? So that's what I'm going to be looking at today. In regards to hospitalization numbers, which everybody is watching, our inpatient beds, acute care is still it's at 85%, which is a lot, but it's still sort of it's sort of steady. ICU beds capacity, we're at 88%. Again, another record today. As far as COVID-19 patients, inpatient, basically acute care beds, another record. Not a record in ICU for COVID patients, but still very high. So we're still seeing that same thing we talked about yesterday, where COVID-19 patients are coming up and becoming a larger share of hospitalizations.
Yeah. When people are looking for hospitalizations, I get asked this question a lot on my Facebook page, where they can find those. Those are all listed on the Department of Health's website, where they
Yeah.
get in a little bit more. It's even broken down, if I'm not mistaken, by age groups in there, so they could see whatever number pertained to their particular life that they wanted to watch a little closer.
Absolutely. I will share my screen again and show that. I'm going to go back to the the ADHS dashboard, which of course this is the sort of main source of data for everybody. So when we go to the
anyone can access this. I want to stress that because we get asked all the questions a lot, and it's just a matter of understanding where to find them. Even I tell people, just bookmark this at the top, the page that's of most interest to you, and then you don't have to dig for it each day. I know that sometimes it can be cumbersome, if not slow to load, because so many people are on the site.
Yeah, exactly. And as you can see right here, there is an age group breakdown for hospitalizations. We have about 4,400 recorded right now in the state. And as you can see, the less than 45 years is about 1,000 of those hospitalizations. And this is, of course, an over time. So that's a cumulative number of hospitalizations, not who is currently in the hospital right now. To see who is being recorded as being in the hospital right now, there's no demographic breakdowns, but you can go to hospital COVID-19 specific metrics. And here, this is where they show you what these numbers. And as you can see, inpatient COVID-19, again, a record today, and it's just gone up since the 26th. And then to go to the ICU numbers right here. And this is what I was talking about, how it's sort of, this was our record on the 22nd, but we are just only 3 beds, below that record today. So that just means that we're seeing a leveling off of ICUs, but it's not enough to establish a trend at this point.
When somebody just wrote in, Kelly Vernon says, I'd like to see the number of recoveries. We would too. There's only one way that it's really being tracked at this point. And there's Kelly's comment right there. Wish you would show the recovered patient count. That is not something specifically tracked. You can talk, Garrett, better about the best metric we have at this point to judge what this is, while keeping in mind this can be, for many people, a very long virus to fight. I had a friend who was sick for over 60 days and just could not get better. She fortunately did not have to be hospitalized for it, but she just couldn't kick this thing. So sometimes tracking this is a long ways out. What is the best metric we have? We went over this a little bit yesterday, but to answer Kelly's question.
Yes. So again, I'm going to go back to sharing my screen here because there is only one metric we have right now to measure what is a sort of what's called a proxy number, which is it's the best number we have to assume recovery, and that's this COVID-19 discharge number right here. So as you can see with this number, we had 203 people on June 24th discharged, COVID-19 patients discharged from the hospital, and that has gone up steadily. We're at about total, if you total up this discharge number, we're at about 8,000 discharges for COVID-19. And that is what when you look at Johns Hopkins University or any of these others, COVID tracking, any of these other places that look and they have a recovery number for Arizona, they're relying on this as a recovery number. Now, we don't report this as a recovery number because it's not for certain that this isn't a situation in which someone entered the hospital here and then re-entered the hospital and was discharged here and then re-entered over here and was discharged. It's not, there's too many sort of variables to use this as a hard and fast recovery number. But as far as it is the best number we have, that is absolutely true.
Yeah, it's to be discussed what also defines a recovery.
Yeah, I mean, there's
about yesterday. Yeah,
there's several different epidemiologists sort of have several different ways of doing this. There's some of the models say it's for younger groups, it's 2 weeks. As long as they haven't passed away, then they're considered recover. For older groups, it's like 27 days or something. And then you would take all those into a formula and ascertain a recovery number. So it likely, if you presume, and especially because our case growth is driven by those 45 and unders, we have that 8,000 hospital discharge, but in all reality, the recovery number, it probably is higher than that. But
right.
No one has settled on the formula, and the state hasn't settled on a formula yet, so we just don't have it right now.
Right. Anecdotally, another friend who was released from the hospital, he's still fighting a lot of the effects. So he would be considered, based on those numbers, recovered. But I mean, the guy's in a rehab center still fighting through everything. So
Yeah, and that's exactly right. The recovery number is always going to be a general estimate of
wow.
the entire population of COVID-19 patients. So, you can say, oh, I'm just throwing out a number. It doesn't mean anything, but 18,000 people are considered recovered. But, as you said, a certain portion of that population is still, even though they might be considered recovered, they're still, fighting off some of those after effects.
Yeah, I want to get to one of the other questions there. Anita Piazza just wrote a little bit ago, a few minutes back as we were talking. Anita wrote, "What's the plan going forward?" And what is the plan? We're kind of waiting for that right now. I want to update everybody. We are expecting the governor to speak at about 3:00. Some people have been hopeful we'll get a little more information about what the plan is going forward. We don't know at this point. We're waiting to see. I want to let you know where you can watch it, of course, right here on Facebook and also on ABC 15. We've got a whole section dedicated to coronavirus. That's at abc15.com/coronavirus. It's a mouthful, but it's easy to find, and it'll get you all the information. You remember when Governor Ducey spoke last week is when the cities were then allowed to decide if they wanted to implement some sort of mask mandate. So Doug Ducey did not put it in place as the governor, but he left it up to local municipalities to put that in. The cities then chose to or chose not to. And then after that, the county said, wait a minute, we're going to step in and we're going to make it countywide just to make it a little bit easier instead of this hodgepodge situation of who required masks and who didn't. So to answer Anita's question, we're hoping to get a little more information coming up at 3:00. Garrett, some of the other things we saw coming out some of the other headlines that we saw coming out over the last 24 hours, Chandler Unified School District is pushing back their start date. Disneyland won't be opening up as planned on the 17th of July. I know people might have been thinking about traveling out there to California. So with those two things in mind, looking at the start date that would have been for Chandler, which is in the last week of July, and Disneyland opening on the 17th, when we say things are lagging here sort of by every 2 weeks, we're going to likely be seeing a higher death count at that point, which could be probably unsettling for a lot of people to see. Will we also be watching very closely at the number of positive tests that are still coming out at that time to see if we're likely in a plateau or if possibly we could have passed a peak in this next month?
Oh, absolutely. The percent of positives will tell the story at that time. We're looking at, like you said, the lag is going to be about 2 weeks no matter what. That's because, and again, I'll share a screen, just make sure I get the right one. 1 second. I'm going to pull up the actual, I'm relying a lot on my Twitter account today. I apologize.
Yeah, no, that's okay. I do want to say your Twitter account is such a helpful place to find all the information. You have it up first thing. It's one of the first places I go to in the morning. ABC 15 Data Guru, and you've got all the breakdowns right there. Oftentimes I'll share that over on my Facebook page as well. All right, so
this is what I'm showing you today. This is the actual Epi Curve for cases, and you can see this is about May 26th, and that's when we started to have this mass projection. These are filled in. This light blue is filled in today. The dark blue is what was yesterday's, and you can see that after about 7 to 8 days, 9, 10 days, the blue stops to the light blue is no longer a significant factor in the growth after about 9 to 10 days. So this is what we're looking at for the lag. So as time goes on, this fills in, and so in about 2 weeks, we'll be able to see if this right here is going to materialize as a plateau to this, or if it's going to go higher. It's going to take us about 9 to 10 days to find that out.
Yeah. One of the other questions I've been getting an awful lot, I don't know, to be honest, if it's tracked anywhere. Is anyone at this point tracking any underlying conditions? It's something people talk about often. Is that yet tracked anywhere?
So what I would say to that is, if it is tracked and if the AZDHS is using it, they don't make it public. So we do not know. We do know some things. Let me back up just a little bit. Maricopa County's health department does produce some graphics and some data on underlying health conditions and high-risk individuals and how it's impacting them. But this is, again, a county-by-county basis, and really it's Maricopa County that's leading the way on this. We don't have any of that at the state level to make estimates on any of the other places. We can only look at Maricopa County for that. Now, of course, Maricopa County is what, 62, 63% of the entire state. So, you know, it's a really good estimate of what's happening elsewhere. But that's really where you have to go to find out what those comorbidities and high risk factors what it's doing and how it's affecting hospitalizations and deaths.
Yeah, I know Maricopa County's site has offered sort of a look back as well too, that you were saying you can click on some of the dates and see, get a better idea of how things were in the past. This is a snapshot of today. Yeah,
they produce a PDF every day, and on their site you can go and look back as far back as early May and see how it's grown in the county since then. So that's a very good resource, especially for tracking this sort of thing.
How do Fridays, we're coming up on where it is a Friday Eve, how do Fridays typically look? Is there any outside factors that make it look differently, or is it just like kind of any other day of the week? I know Saturdays and Sundays and Mondays have some different tendencies based on weekend reporting. Is Friday affected in any way?
No, Friday will be because Friday is really tests that came in on Monday, Tuesday, Wednesday, Thursday, and going back farther than that. So it's a weekday. I mean, I know it's a weekday, but it's really it doesn't factor in sort of weekend closures. That's why we see lower numbers on Sunday and Monday, because some of the labs that report are closed on Saturdays. So you lose, a whole portion of tests, and then same thing with Sundays. On Mondays you don't get tests that were supposed to come in on Saturday and Sunday. They don't get released till Tuesday.
Yeah. What are your key takeaways of today's numbers?
Like I said, what I'm looking at is that I'm sort of hopeful that there is a chance that we're coming to a plateau, but unfortunately we won't know for a couple weeks. But sort of everything's following the trajectory that we've seen in the updated modeling. I'm hoping we have about, about 3 or 4 more weeks. It might get a little ugly, but after that, it might start to level off.
Yeah, we sure hope it gets better and fast. All right, a couple more people are asking what Doug Ducey will be talking about. At this point, we're not sure. We're about an hour out from him speaking, and we'll have that live right here on Facebook Live and also on abc15.com. Vicky's asking, can we please show the web addresses one more time so that people can find those? I believe, Vicky, you're talking about the AZDH website, Arizona Department of Health. Garrett, you want to show those too?
Yeah, it's the website's very easy. It's azdhs.gov. I will show it one more time. I don't know if it shows the actual, but if you just I'll just go to the very beginning. This is what the initial page looks like, and right there is the data dashboard, and that's where you go. And this is updated at 8 sometime in the 8 o'clock hour every morning, with all of this information being updated.
Yeah, and Vicky's saying yes, that's the site she was looking for. I know some of the little circles are kind of hard to read for folks to write there. They highlight hospitalizations, summaries, the demographics, the deaths that have been reported. This is even where you can dive into zip codes. I will say one thing: when you click on the zip codes, Garrett, I believe it still takes you through a separate site.
It takes you to a different website because the zip codes are hosted on something called ArcGIS, and this is the zip code map that the AZDHS has put together. It has a gradient that goes to about 250. You can also download the data and do whatever you want with these zip codes and change the gradient levels. You see dark reds in all of the Yuma sector, and also in most of the urban, especially Southwest, is where you're seeing a lot of the 250 plus cases.
Yeah, we kind of touched on it a little bit yesterday. Vicky's saying thank you also, Garrett. So thank you for showing her that. Obviously, it's of note and of interest to be looking at your own websites. It doesn't necessarily mean that they're not the same size, they're not the same populace. So that's just something to keep in mind when you're comparing your
Yes.
code to your neighbor's zip code, or
Yeah.
your zip code to your work zip code, or things like that.
Yeah, zip codes are not something that the census uses to balance demographies. So, you know, there's going to be very different density and population numbers in zip codes as opposed to, like, say, census blocks or tracts or something like that. You're going to have very different numbers. So that's always something to take into consideration.
Yeah. Mandy just wrote in that she lost her cousin after just a short 7-day battle with COVID. And Mandy, I first want to say, I'm so sorry for your loss. I've had so many friends go through the same thing. Countless friends, really, at the beginning of this, when there was not as much information out. And your cousin's memory and Mandy, you being on here means everything, because that's why we're helping people to try to find the numbers, to teach them how to find these numbers, where to go to find them. Because for every family, Garrett, your family is going to be different than my family, than Mandy's family, than everybody on here. And we want to be able to say, you know what, a 5% infection rate for me might make me feel comfortable to fill in the blank, go back to the gym, send my kid to school, whatever. And so we don't want to define the number for you. We want to help you be able to find where that number is, so that each day you have a metric that you can follow for your family to make the best decision for your life about when to do whatever it is in your life, so that you could be the safest. So Mandy, thank you for sharing your personal story of what your family's gone through, and in Brandon's memory, that's why we do this. So thank you. Garrett, was there anything else that you wanted to add for today? I know we're getting a lot of questions in, and I'm going to continue to read through all of them and try to keep everybody updated, and jot down some of the questions so that we can answer them tomorrow if we don't get through them all today. Is there anything else that we should touch on, you think? Or
Yeah, I just want to encourage people to go and see Lily's piece this evening on the impact that the COVID-19 is having on the Hispanic community. It's a pretty powerful piece.
Yeah, I look forward to it. Her reporting is excellent. I'm so proud of all of our reporters, actually, that everybody, you included, everybody's doing things remotely, and we're still able to provide this level of coverage for our communities. And so thank you. So I appreciate you, Garrett, for joining. I want to remind everybody, we're trying to do this every day. So Garrett and I will try to be back with you about the same time tomorrow to answer your questions. You can post more questions here. You can post questions on my Facebook page over at Katie Rammel. Garrett, tell everybody your Twitter handle, so that they'll be able to follow you and converse with you there.
Yeah, it's at Garrett, GARRETT_Archer. And it's the AZ ABC 15 data group.
Perfect. And we want to remind you at 3 o'clock, what time are we now? About 2 o'clock. We're expecting the governor to speak. All the info is going to be right here. We'll carry it live, and we'll keep you updated on our newscasts as well. And for more information, as you see on the bottom of the screen, you can go to abc15.com/coronavirus for all the latest details. And we'll see everybody tomorrow. We want to thank you all for joining us.